The following is a paid commercial program paid for by Restoration Health. The opinions and views expressed in this program belong to its sponsors and are not those of this station or their affiliates or their employees.
Do you have chronic pain that you haven't been able to get rid of? Have you been told that you may just have to live with it? With us today is Dr. Keith Beachy from Restoration Health right here in Little Rock. Welcome to the show.
Thanks for having me.
And luckily, you've got good news for people that may have been told that you're just going to have to live with that pain. So we know that chronic pain can be very debilitating, and that's what you help patients with every day. Could chronic pain be neuropathy?
Yes, chronic pain could be the result of several conditions, one of which is neuropathy. If someone has burning pain or a numbness and tingling, muscle weakness, sensitivity, or even electric-like pain, especially in the legs, feet, or hands, that could be neuropathy. These symptoms can start off very slowly, but they increase over time as that nerve damage worsens.
Is this something that, you mentioned it increases over time, but is this something that, is it a result of like a specific injury or emergency, or could it just come into your body as you get older?
So
does that question make sense?
We know that there are over 100 known causes for neuropathy.
Wow.
One of which is, like you mentioned, is traumatic injuries, but there's also people that have diabetes that develop neuropathy. Some people go through chemotherapy and develop neuropathy. Metabolic conditions, there's a whole host of things that can develop neuropathy.
And so what should someone do if they are fighting chronic pain or neuropathy?
The best course of action is to see a professional and get a complete evaluation and diagnosis. There's been some significant advancements in the treatment of chronic pain and neuropathy. And there's actually some really unique treatments that we employ at Restoration Health that can help heal the nerve pathways and start to restore those nerves back to normal.
But how does someone know, as people that are watching, how do they know that you guys can help them with what they're dealing with?
So in our office, each patient is evaluated by one of our team members to really see if our treatments will help them. Then from there, we will create a custom treatment plan for that patient. I want to note though that we don't use any medications or drugs and no injections. Our treatments work at the cellular level to help relieve chronic pain and really improve someone's range of motion and their overall mobility.
And for new patients, I should say, so our viewers, you've got a special, a $49 neuropathy special. Tell us about that.
That's correct. So our special, that includes a personal consultation, a very detailed exam, and then a report of findings. Our exam process is so thorough that we can actually narrow down to the exact percentage how much sensory loss a person has in their hands and feet.
Absolutely incredible. And do you have a long wait list out there? If someone is watching and they know that you could help them, is it like make an appointment and then wait for 2 months in pain, or how quickly can someone be seen?
That happens a lot with typical doctor's offices, but in our office we do see a lot of patients, but the way we run our office, we're actually able to get people in really quickly so they can get the help that they need.
Like
fast.
Maybe within a few days?
Correct.
Awesome, awesome. Okay, so let's go back to that, that special real quick. It's $49, and that includes what?
A personal consultation, a very detailed exam, and a report of findings where we sit down with that patient and we go over the objective findings so that that person can make a detailed and really informed decision based on their health that's accurate and, again, based off objective measures.
Dr. Beachy, how does someone know if one of these new patients would be right for them?
So each patient is evaluated by one of our team members to see if our treatments work for them. Then we will create a custom treatment plan for that patient. And I want to note that we don't use any drugs, medications, or injections. In fact, we have the most advanced non-surgical FDA-cleared treatments available that focus on regenerating nerves and arteries.
Call that number on your screen, and if you call now, you can get that $49 neuropathy special. And remember, it is for the first 25 callers. That's Dr. Beachy with Restoration Health. Thank you for joining us. We'll see you next time.